Now to a health alert. November is Diabetes Awareness Month, if you didn't know, and we are joined by Lindsay Schlichting, a certified inpatient diabetes care and education specialist at Denver Health. Thanks for joining us.
Thanks for having me.
So we were just chatting a while ago. It's Diabetes Awareness Month. Unfortunately, it's all too common here in America. What is prediabetes? What are the conditions of that?
Yeah, so prediabetes is basically a situation where blood sugar levels are elevated above normal, but not quite high enough to classify it as having diabetes. If you've been diagnosed with diabetes, there's kind of two types that are the most common to have, type 1 and type 2, but of those two, type 2 is way more common. About 90% of people living with diabetes have type 2.
So is this something that can be inherited? What are some risk factors people at home should look out for?
Yeah, so definitely genetics can play a role. We know that if you have a first-degree relative, like parents, siblings, that's a risk factor. We know that sometimes in communities of color, they tend to have higher rates of diabetes as well. So if you belong to a higher risk ethnic or racial minority or group, that's a risk factor. Age, unfortunately, about 50% of adults in the U.S. or adults over the age of 65 have prediabetes. About 50% of them. If you are a woman who's had gestational diabetes or been diagnosed with polycystic ovary syndrome, and also just if you just are, have kind of a more sedentary lifestyle, not very physically active, that can also contribute.
Yeah, and you said age. Unfortunately, it's not something you think about when you're younger, which you should now. So what are some things you can do to try to reduce your risk of getting diabetes?
Yeah, so I think first of all, just identifying those who are at risk. So the American Diabetes Association does recommend screening, that it should start at around age 35. It may occur a little sooner if you've been identified as being a little bit higher risk or if you have more than one risk factor. But in general, we should be screening everyone over the age of 35. If that comes back normal, then they may just be screening about every 3 years. But if you are diagnosed with prediabetes, it might be annual screening after that.
Now, you said screening. Is that a blood panel? What is that?
It's typically a blood test. You can diagnose diabetes a few different ways, but it is typically a blood test.
And if it's too late, you're starting to feel sick, what are those signs and symptoms you need to look out for?
Yeah, so some of those classic signs of high blood sugar are things like frequent urination, increased thirst, sort of a dry mouth. People can feel really fatigued, run down, may experience blurry vision or unintentional weight loss. But I do want to mention that a lot of people who have prediabetes and diabetes sometimes experience no symptoms. So just feeling fine doesn't necessarily mean that it's not occurring. So it is important to talk to your doctor about whether you should be getting tested.
Yeah, that screening is so important. Can you talk about really quickly, what are the next steps if you are diagnosed with diabetes?
Yeah, so I always say that diabetes is a team sport. And so who's on the team? I think family and friends can play a huge role in helping people navigate, challenging the challenging chronic medical condition that is diabetes. And then I think on your healthcare team, for sure, at the minimum, having a primary care provider who can prescribe medications or complete those annual health checks and screenings, working with folks that are specialized like myself, maybe a dietitian, pharmacists. We have community health workers that are receive special training in providing basic health education.
Yeah, it's always good to have that support system around you, especially in these times.
Yeah.
Thank you so much for joining us, Lindsay.
Thanks for having me.
Absolutely. Josh will send it